Welcome, everyone, to the Reframing Eye Care podcast. I have APHA with us today. What an important organization to optometry that a lot of people do not know about in the work that they're doing. So, welcome to the podcast. Thank you for representing such a great organization.
Of course, anytime. Thank you for having us here.
Yeah, so I've had you on before, so a lot of the listeners do know you. But can you just introduce yourself? What is your role with the Vision Care Section of APHA?
Of course. So my name is Dr. Otoo. I am the current chair of the Vision Care Section. So APHA meaning American Public Health Association Vision Care Section. I am an optometrist currently practicing in Indian Health Service in South Dakota, so a very small town, rural America, trying to, do eye care and public health. Yep.
Excellent. So you mentioned you have formal education and experience in public health. Can you tell us about that? I mean, I think a lot of doctors would be interested in something like that. That kind of really gives back.
Sure. So, I'm an optometrist. I went to school at the College of Optometry, Ohio State College of Optometry. And I also have a public health degree, epidemiology and biostatistics from the University of Illinois at Chicago. So with optometry, I am a clinician, and from public health, I have a nonprofit that I founded during COVID times. So also trying to improve visual health literacy through the nonprofit. So somehow trying to integrate these two professions, and it's interestingly taking its own form. Like I said, I'm in South Dakota, a very small town on a reservation serving Native Americans, and that is very public health. In fact, it's been 18 months since they had an eye doctor here. So I am filling a huge gap, and I'm very excited to be doing it. So I just have, public health nurses, public health dentists, public health pharmacists. That's what the IHS facility looks like. So I feel right at home being here, except it's too far away from my family in Chicago.
It's probably super cold over there too today, right? What's the degrees?
Yeah. It was 10 yesterday. I think this morning it was like -7.
Yeah, I'm not a cold person. I think it's great work I think it's great work that you're doing. Giving back to patients that can't get access to care because of air, and then doing it in person. Having an optometrist in person. I think a lot of that access to care, remote locations in the industry has been disruptive technology, but it's good to be able to have a doctor on site. And thank you for what you do there. The Vision Care Section, why was it created? Was it created for, locations like this?
Not necessarily. It was created by a group of people, including, eye care professionals, as well as people who have like allied healthcare, who have some relationship with eye care. The goal is that, vision care is public health, and to draw people's attention to it, it does bring in multidisciplinary leadership and membership. Because, as a provider, we cannot work in isolation. A lot of what we do is affected by other diseases. So it's just created to bring a community together, people who will promote vision and eye health, and kind of sounded the alarm on how important this is in public health. So the Vision Care Section in itself is one of 33 sections in the American Public Health Association. We are a small group, compared to sections like epidemiology, but we like to think of ourselves as small and mighty. We do a lot of great things within APHA, and we'd love for, others to join us and, join forces and, keep sounding the alarm of how important vision health is.
Yeah, I'm sure a lot of doctors would like to be involved, and hopefully they, from this podcast, inspire them to want to get involved. What does the Vision Care Section do with APHA?
So the Vision Care Section promotes health with emphasis on eye health. Okay. And we want people to recognize how essential vision is to the overall, health and well-being of people. So Vision Care Section is also the leader in terms of creating policies in eye care. Again, we want eye health to be integrated into the very fabric of our society. So creating policies so that different organizations can implement it and use it as a kind of like a tool for their work. It's the leading, leading eye care in the US. Yeah.
Great. Who are your members, and who should, consider joining?
anybody with interest, anybody who is working in eye care. You don't have to be an eye doctor. We currently, predominantly the members are currently optometrists, but we do have some MDs, we do have some researchers, we have some PhDs, some school nurses, we even have a lawyer on the team. So basically we want everybody, I always say we all own a pair of eyes, and therefore we should all care about eyes. So if you are remotely interested in vision and eye health, I think this will be a very good place for you to join and kind of help forces and push this agenda forward.
Excellent. No, vision care is a public health issue. Why is vision care considered a public health issue and not just a clinical one? I think that a lot of people think of it that way.
Right. So I think of it this way: vision health, eye health. The name in itself ends with health, right? Now, if you compare it to other health conditions, we know there's a term called social determinants of health, a very big topic, word in public health. So I think of it as, when you think about social determinants of health, it's the non-medical factors that impact health, right? So where somebody was born, where they work, where they grow, the community that they live in. All these things undoubtedly affect vision and eye health. Once again, here I am in South Dakota. There's one grocery store near to me, and then miles and miles away, like an hour away, 45 minutes before you see another grocery store, right? So if I have a diabetic patient, I'm going to use South Dakota in a lot of my examples, but when we have a diabetic patient, we advise them to eat healthy and exercise. But if you live in a desert, like a food desert, how do you access those green vegetables and fruits? Already the remedy you're giving them, they don't have access to it, so they can't address their diabetes. And then we tell them to exercise, right? So the cheapest way to exercise is to have green space, parks to go to. And if you don't have that, once again, the patient will not be able to follow your advice. So hopefully that is clear in why vision health is public health, simply because it's health and all these social determinants of health. The use of health is a lot, but because social determinants of health affects vision health, that in itself makes vision health a public health issue.
Excellent. Excellent. Thank you for explaining that. And it's right. You're so right on a lot of those things that we kind of, maybe in Rhode Island or Boston don't really take into account, because you can kind of have multiple, pharmacies, groceries, doctors right at your access, right? There's a lot of there, access, equity, advocacy is very important. What's the biggest barriers in vision care access in the USA?
Yeah, it's cost, insurance. I think that's what it is. It's big everywhere you go, whether you find yourself in a small town or if you find yourself in a big city. There are many people who do not have insurance, and so sometimes they would have to pay out of pocket, and that amount of money is usually hefty. So then they would prioritize other things, right? A lot of times eye is not going to cause death, so people will kind of delay it. I quite recently had a patient, and sometimes I'm very surprised to see this in the USA, where a patient as of 2 years ago had vision in both eyes, and within 2 years lost vision in one eye and did not care for it until the other eye also decreased in vision. And granted, when I saw him, it was something as reversible vision loss, because it was cataracts, right? It was cataracts that has just progressed and progressed. So granted, he will get his vision back, but it's an example of not having access, not having a doctor in the area, and cost. They kind of put that on the back burner until vision is, its vision impairments has occurred, right? And kind of to go back on why is vision health a public health issue? It can be prevented. I believe 80 to 90% of vision impairments globally, as well as the US, is due to refractive error. And we know that refractive error is correctable. So prevention is huge in public health. We want to prevent rather than treat. So once again, that's a reason why vision health is public health. But yeah, cost is a big factor.
No, of course, cost is always a factor with a lot of patients, right? How does vision care intersect with health equity and social determinants of health?
Sure. I kind of alluded to this earlier with social determinants of health being the non-medical factors that affect eye health or health in general. So if you live in a community that you don't have access to food, you're already going to struggle there. You don't have transportation to go to your doctor's office. That's going to be an issue there. Again, I'm here in South Dakota, and the no-show rate is pretty high, in part because it snows over here, it gets really cold over here, and people don't have the means to get to the clinic, even when they know that there's a provider here after so many months. Okay. Now, when it comes to health equity, once again, things are not equitable in the States, so it makes you have differences happening in how people experience different issues. And so we have to make sure that people have some access to the care that is available and make it equitable. Now, when you compare South Dakota to other states, it can easily be spotted that things are not equitable. And so, health equity and social determinants of health, that's how they intersect.
What policies or public health initiatives can you improve access to vision care?
Okay, so the Vision Care Section within the past 5 years has implemented a number of policies. So one of them being increasing integrated health for diabetics. Okay, now I would have to share the policy with you for folks to read about it, but there has been a number of policies, including one for fall prevention, simply because if somebody cannot see, the risk of falling is increased, right? So we have policies for that, and other policies pertaining to children eye health. That's also another policy that the Vision Care Section has been able to get published and promoted out there. So these policies are existent. We just need organizations to use these policies to do their work. I'm not sure if that answers your question.
No, I mean, just overview. I think a lot of doctors are not familiar with this organization. I think you guys do a lot of good work, and I think it's important to talk about the things that we talked about because, I mean, the biggest push in the industry right now is access to care, and the doctors, a lot of optometrists, want to help, want to be involved, but we have disrupting technology that kind of says, "Hey, we are the answer for it," and
Right.
I think we need a doctor's backing to say yes or no on some certain situations. But access is an issue. But it's good to know that there are doctors that want to work in those settings and want to help. You have programs. What initiatives and programs for the Vision Care Section currently are you working on? And maybe something that maybe other doctors can get involved with even from afar.
Right. So currently what we are working on, I mean, at this point, the APHA has a pause on policies. So policies are not our focus at this point, just because of everything that is going on. But in the APHA section in itself, we have been educating other sections or members of APHA to prioritize eye health. We are trying to start internally and then go out, right? So during our annual meetings, we actually hosted our first vision screening at the annual meeting last year. And it's quite interesting to realize how there are so many health providers who still do not seek eye care. So being a health provider does not mean they do kind of right when it comes to their eye health, So what is the Vision Care Section doing? We are trying to start internally meaning within APHA in itself. And then in terms of what we are going to do out, just continue educating people, working on policies as best as we can. Again, that is all dependent on the larger APHA organization.
Yeah. Oh no, I think it's important work. A lot of volunteers that are passionate about this. You've had some success, right? Can you share any success stories?
So the success stories would be successfully enacting these policies. And there has, in the past 5 years, I mean, we have been able to, I want to say, be able to publish or implement 5 different policies. So I think that in itself is success, because it takes a long time to work on policies. It takes years and years and years. And there has been times that the AOA, actually, I want to say about 2 years ago, did publish about diabetes and how public health and diabetes, public health and eye health could work in tandem to improve visual health outcomes for diabetic patients.
Yeah. Oh yeah. I mean, these organizations, people, the committee, a lot of doctors are not involved in. They just don't know how much work, how much effort all these volunteers do and how it really helps us all as a profession. So
Right.
I thank you for volunteering, being involved, a lot of doctors being involved, a lot of people that have dedicated their careers to the profession. I've highlighted them on my podcast. So, I think it's great for the work that you guys are doing. And I wanted to highlight you because it's work that benefits all of us, but maybe doesn't get recognized.
Yeah, certainly.
So,
certainly. Yeah.
I think, students should get involved with something like this. Professionals just starting out. Is there ways that people can get involved? I mean, I know you have leadership doctors that have been doing this for a long time that will mentor,
Yes.
these young ODs and kind of give them a head start to be involved in the profession.
Yeah, for sure. So I have been part of the APHA for 10 years, and I started as a student, as a master's student in public health. So I've been part of it as a student, and I have grown into what I am doing right now. So indeed, there are so many opportunities for students to participate. We currently have 11 different committees that students are a part of. We have at least one student member be part of each committee just to kind of help their students learn the ropes and learn how to become like an actual hold an elected position in the future. We also do have mentorship programs that would kind of pair students with different professionals within the section and kind of grow and learn that way. But yeah, I will always encourage students to join. It's a great place to be. It's a great place to get to know people who have the same career like interest and the same goals and the same kind of motivation. I'm kind of reminded of when I was a public health student, my mentor was an optometrist, and she's in part the reason why I was able to go to optometry school and be able to do what I am doing right now. So mentorship is great, and student opportunities, students should just grab them. It's always a good stepping stone to bigger things.
Yeah, I mean, there's a lot of leadership opportunities in eye care, and we never really get there without a mentor, right? There's a select few individuals in the industry that kind of make it on their own, but in general, you always need someone to kind of mentor you and help. And this might be a great opportunity for someone looking to do a leadership position and make a difference in, the community and into the profession.
Yep, I agree.
What does the future for vision care in public health look like? What do you envision it? There's a lot of different things that have changed dramatically, even over the last 5 years.
Yeah. I think the vision is for vision care to be seen as an integral part of our healthcare system, for it to be truly viewed as a primary care thing, right? Where it would be somehow integrated into people's routine medical visits, and it's not treated as like an afterthought, right? So I think that would be a great place to get to, where there would be a shift to prevention, right? And again, kind of to reiterate, huge percentage, 80 to 90% of vision impairments is preventable. And so this is where public health comes in. There is no reason why people should be blind from refractive error. Also, moving into the direction of where health equity as it relates to vision is a priority, kind of closing the gaps in cost as well as insurance, expanding Medicaid coverage, having community programs, and just making programs accessible to people. I think that's where the future of vision is going, or would like for that to go, and ensure that vision is not, again, that people don't get visual care simply because of the social determinants of health that I have mentioned, the lack of awareness, lack of access, the lack of awareness, the lack of resources, that those will all not be significant part of accessing vision care in the future.
Yeah. And just a call to action, why should, public health professionals care about vision?
Well, in my view, all health providers are doing public health, whether they recognize it or not. Okay. A lot of conditions or diseases that providers or researchers are researching, a lot of them, if not all of them, have visual implications. Obesity, diabetes, high blood pressure, even gun violence, like all these public health things going on, if I should call it crisis going on, all have some sort of vision implication. Therefore, professionals should be interested in public health. And it's kind of like a cycle where one could argue that you're treating their symptoms instead of treating the core issue, right? So again, if we have diabetics in a society and they are not eating well because all you have is convenience stores, doorless stores around, and they only have access to the processed foods, then you are not treating the roots of the problem by giving them the metformin, right? Rather, we should go down to the roots, the foods that people eat, their access to green space to exercise. And once we address these problems, not to say that all the later problems will go away, but it will be much reduced. So hopefully I've made a case for why professionals should be interested in public health. It's all very much interconnected and should not be treated as a completely different field. Yeah.
No, I think it's great work that you guys are doing. I think optometry community should know about it, should get involved. If they want to get involved, if they want more information, how can they get that information?
They can visit the American Public Health Association website. And once you visit the website, you can become a member. And when you become a member, you just make sure that you join the Vision Care specifically to be part of the Vision Care section. APHA has 33 different sections. So there's so much room to grow and so many things that will pique one's interest. But just make sure you pick the Vision Care section in addition to any other sections that you choose to join. So the website will be apha.org. And you can email us at vcsapha@gmail.com if you have any questions. And we will be happy to help you and welcome you into our beautiful and renowned organization.
Yeah. Thank you again for taking the time to explain what the work you're doing and how optometry is so important in public health. Thank you again for coming on, and I hope that the listeners want to be involved and volunteer their time.
Of course. Thank you for having me.
Excellent.